Hi, Kathy. Tell me your name and tell me your story.
Okay, I'm Kathy Hine, and I'm from Weston, Missouri. And August 31st of 2001, I noticed a headache that would not go away. Now, I'd had headaches in the past, and off and on, like I suppose most people do. But I noticed that this one was stronger and worse, and didn't really ever let up. So started kind of watching that. And after a couple of weeks of me complaining I had a headache yet again the next day, my husband said maybe we ought to have that checked out. So went to the local doctor, just our regular family practice doctor, and he gave me muscle relaxers and painkillers. And so tried that for a while, and really it didn't ever lessen. As a matter of fact, sometimes it got even worse. So it would wake me up in the night as I was sleeping, and I would have to take more pain medicine then. So we went back, and they decided maybe I better go to a neurologist and have an MRI done, just to make sure that there was not a brain tumor, something like that going on inside there.
This how many months afterwards? This was you started. You had a specific date.
Right, that's in September. So August 31st is when I noticed the headache. It's kind of funny because I was having a dinner party, and I couldn't concentrate on the conversation, and that was why I remember specifically when when it was really
and that headache wouldn't go away. It just stayed.
It didn't go away. Not any real relief from the muscle relaxers or the pain pills at all. So went to the neurologist, had the MRI done. It was a horrendous 6 weeks waiting for the results. And that's, you wonder, okay, so my son going to watch me grow up? He was 6 years old at the time. Now, we had been on a mission trip, and we thought maybe there were, when the brain tumor was not something, then we started looking at other results. And so we thought, well, maybe it was because I had hit my head in Guatemala on a mission trip, or maybe it was because I had, picked up some kind of a disease or something while I was there. But the first thing we went to check out was the TMD, and we went to the dentistry school in Kansas City.
And what did you think of that? Did you feel pain in that area?
No, my mom talked to a neighbor, and her daughter had headaches, and that was the answer for her. That's where she had gone, and so that's where we went as well. Now,
this is UMKC School of Dentistry?
Yes.
Okay.
And they were very nice there, and at the time I really thought the care was good, and after several weeks, then that was not really the answer. No.
What did they do for you?
Built me an orthotic. And
was it a splint that you'd taken it out?
Yes, and it was hard plastic.
Okay.
And it just
did they call it an orthotic or a splint?
Maybe a splint, probably a splint.
Okay.
Yeah. And so that didn't really make any difference at all in the pain. And I don't know if that's because it was, I don't know why that was.
Because they did the best they knew how.
Right.
Okay.
So then we realized that, okay, well, if it's not that, so we'll just move on.
Did they then tell you it's not TMJ?
They did.
Okay, that's what I remember, because they basically said at the TMJ clinic,
right,
you don't have TMJ.
Okay. That's not it. Keep looking. So we went to endocrinology and physiatrist, I think is what she was called. It's a pain specialist. Just kind of manage the pain, since we couldn't figure out what the problem was. About 2 years after the initial symptoms, I started going to a doctor in Wichita. And he is...
Wichita's about 3-4 hours away?
3.5, 4 hours, yeah.
Okay.
And he is an MD and also a holistic specialist as well. So we went there, and he's really a great guy. And what's really funny is that I knew about him from a friend who went there, and they are a whole body clinic. So they don't just look at one area, which is what we had been doing, was looking at one area specifically to see if we could find the problem. So they did a whole lot of tests and did a bunch of whole body things. And there they diagnosed me with fibromyalgia.
Okay.
So we did a lot of different things that are traditional and not so traditional.
For fibromyalgia.
For fibromyalgia, thinking that was the cause of the headache.
And how did you find us?
Well, nothing helped, so I gave up. And I tell you, it wasn't, it was really awful missing so many years of my son's life, because he's now, he's 15 now, and he was 6 when all this started. And that was terrible. But the worst part was probably the hopelessness, the not knowing if I would ever feel any better. The
hopelessness, you said?
Hopelessness. Okay. Not being able to, being on heavy-duty drugs. I don't remember a lot about when he was in first grade or second grade, and I couldn't really drive him to school. I had to give up my wonderful job I had. I couldn't do that any longer.
What did you do then?
I was a American sales director at that time, and I am again now, but it's
During that
only
time you
because
couldn't continue?
I couldn't continue.
Okay.
I had to give it all up. And just the emotional roller coaster of going to one doctor thinking that this is the answer, and then it's a ride up, and then it's a huge letdown down. And so I had decided to quit even looking. I thought I cannot continue to do that roller coaster. So, but my mom, my mom loves me, and so she continued to kind of look around, and she heard about a guy in Michigan that did TMJ kind of work, and she said, "Why don't I go to him?" Because we'd been all the way around the circle and coming back to TMJ now. And I said I kind of wanted to find somebody closer to home. So I found you on the internet and set up an appointment and came in, and you said magic words to me. You said, "I can help you, I can make you feel better." And not a, "Okay, let's try this," or I think
we
it might
did
be
that after I did some...
you did some testing.
Not even all the tests. I think at that time I did basically check the muscles, the jaw,
Right.
that sort of thing. Okay.
Right. And then we took the step farther to do the CAT scan. And that really proved it, but even just after that initial checking some muscles, and I remember you put a tongue depressor in my mouth, and my husband was so impressed with that.
We're looking to see if they're level.
Exactly. And he just couldn't believe that. But anyway.
And we also measured your muscles
Yes.
with a lot of computer
Took pictures,
tests.
and I was all sideways, and all those kinds of things. So that was an emotional day for me, because
That was in 07?
that was November of 07.
Okay.
And you said it with confidence, and nobody else had any confidence whatsoever. So we started the process, and we did the orthotic first, and I was hoping that I would be pain-free by Christmas, I remember, and that didn't really happen. And so then we took the next step and put in, now I did have some relief, so then we knew we were kind of on the right track. And so we went ahead and did the braces on the top.
So to begin with, you had orthotic on the bottom only, wasn't it?
Yes, yeah. And it took a little getting used to, but it really wasn't an ordeal at all. And then we did the braces on the top in May, and
That's the neuromuscular orthodontics, right? To move
Yes,
the teeth to where they
Right.
should be. Okay.
And my understanding was so that the jaw would sit right by moving those teeth, and it would sit right and wouldn't be cocked wrong anymore. Is that right?
Correct. So
Okay.
we first put the orthotic based on where the diagnosis said the jaw should be, in the neck and jaw.
Right.
And then we were moving the teeth to that position, and that
Right.
took about almost 3 years now.
Almost 3 years. Well, it's been just a little long since we started the process. It's been a little over 3 years. And look, not only are my teeth pretty, which I didn't really expect they would be, but my pain is so much different. And one of the things that is different, we were talking about earlier, is that in pictures, not only, does my smile nice, but the pain is not in my eyes. It has been, and there was always a dullness to my eyes with pain or painkillers, one of the two. And so now it's just, it's like a miracle.
Are you on any medications now?
No, well, not really. Occasional Advil here and there, but usually for other aches and pains.
And no painkillers and no prescription medications?
No narcotics.
How are you doing?
Really good.
Good.
I don't take them very often, and some days it'll be evening before I even have much pain anywhere, which is fantastic.
Okay.
And so, yeah. And
Did we do any, because one of the things people say about neuromuscular dentistry is we just put a mouthful of porcelain teeth. Did we put any porcelain teeth on you?
no, I don't
None.
actually have any porcelain teeth.
Your own
and I
natural
really
teeth.
thought I might have porcelains, and I thought, oh, how beautiful that would look. And
If you did, that would have been because you wanted to, not because we told you to. That's
Right,
one of the
right.
options.
Right, and so, I seriously considered that. I am in the beauty business, and so I wanted my teeth to look nice, but I'm very pleased that I don't have to have that done, and I have my own natural teeth. And wow, my smile's never been so straight, and it wasn't terribly crooked to start with, but it really has made a
Now you no longer have any orthotic, it's all your natural teeth in the right place.
Everything is right, yeah, everything is back to me.
So what would you tell people that are hopeless?
Not to be, and I will say this too, my faith has been a very strong constant, and I know there's hope in that part of my life, but I was hopeless in not being able to live my life to the fullest. And
you do now.
I do now, yeah.
Perfect.
I have so much energy, it's just amazing.
Thank you.
And I'm just, it's like a miracle. Thank you.
Thank you so much.
Uh-huh.
Bye-bye.
Bye-bye.